This DVD, as you know, has been designed to describe in physiology across multiple areas of medicine how the brain and the body has been damaged by the processes that lead to what we now consider a type of stroke in the body, when small end blood vessels are temporarily and sometimes permanently blocked off when the blood starts to sludge. Blood will sludge in small blood vessels as a consequence of many things, including infectious diseases, including changes in viruses and some vaccines that you may receive, and more particularly some of the heavy metals, specifically aluminum in vaccines, is very contributory to the things that we will discuss in these videos. The slide right behind me here right now, this is basically the big problem in the world that we have. We are trying to control across the planet infectious diseases, and by doing so we realize as physicians and public health care practitioners that the only way you can control an infectious disease in the population is to get something that we call herd immunity. And herd immunity is a concept that means if you have 100 cows on a farm and you want to control an infectious disease in that cattle farm, the only way you will do that with vaccinations is if you get 95% of that cattle on that farm immunized. So infectious disease control using vaccinations will only work to protect the herd if you get 95% of that herd immunized. So the only way that vaccines will work as a public health measure is that they need a very high degree of uptake. And we say that generally meaning you need 95% uptake, meaning that the population as a whole, you must get 95% of the population immunized with a particular virus or bacteria or vaccination in order to ensure the rest of the herd will benefit from the herd immunity. Now that means we have a mandatory, universal, one-size-fits-all vaccination program that is put in place to try to achieve herd immunity, but at the expense of considering us all to be able to handle the same biologically active injections in our body. And that, unfortunately, as we will see in these videos, is not always the case. So right here basically is a young baby, and this is who we are trying to protect on this planet with the vaccine as we're currently deploying them. The pharmaceutical industry, there are various corporations involved in promoting the vaccination programs, and it's become an industry in and of itself. So much so that the vaccines and creating new vaccines has become such a lucrative market that to a certain extent, in many respects, the desire to find new products to give to people, the population from the vaccinations, has exceeded the rationale for genuine need for many of the products out there in the market these days. And this also is contributing to the problem we now consider with too many vaccines too soon for individuals with no real appreciation of who can handle what, when, and why. This next slide here basically depicts the story and the situation we've arisen in. This is shackles on an individual's feet. In many places, especially in the United States, many states have mandatory vaccination laws, and in fact in some areas parents are actually being charged with child abuse for refusing to have their children vaccinated for legitimate concerns. Now, when the state mandates that each individual must have a vaccination in order to participate in society, this is the state imposing its will on the individual. And as you will find out here, some of the information that they've based the concerns upon is based on trying to achieve herd immunity, but also, unfortunately, the scientific evidence to demonstrate that these vaccines, as we're currently deploying them, are actually quite harmful in many respects to many individuals across the board. And without that knowledge, we have, unfortunately, as a society, and with good intentions, caused the greatest harm to mankind in the history of recorded history. And this week's what we will see. My back is in this slide here, very briefly, how I arrived at the point where I currently am at now to discuss issues on the brain and behavior and biology and medicine. My undergraduate training was a bachelor's degree in biological psychology. I went on and did a master's degree in child development and did a thesis in looking at language development in children. From there I went on to a PhD in clinical neuropsychology. Did a subspecialization during that PhD in cognitive neuroscience, the ability to look at how the brain thinks, processes, stores, and retrieves information. As part of that training as well, my PhD thesis was in neurophysiology, electrophysiology, which is looking at how electrical recordings you can record from the top of the surface of the skull and figure out where activities are happening within the brain to generate those. And in my PhD comprehensive exams was on acquired brain injuries and post-concussion syndrome. Now, that wasn't really enough at my training at that point, because I still realized, even after that training and doing my clinical work in clinical neuropsychology, that I still couldn't make sense of the brain and behavioral disorders I was seeing. And I decided to go back to undergrad and take a medical degree at McMaster University in Hamilton, Ontario, Canada. And from there, my training was primarily devoted to trying to understand and explain, why do we get ill? Why do we become sick? And that was my sole purpose for going to medical school. And from there, I went on to residency training in psychiatry and neuropsychiatry, and did most of my clerkship and residency training electives in neurology. And then, lo and behold, out I came into the clinical world for the first time, armed with all this knowledge, and there I began seeing, right before my very eyes, with the eclectic training that I had received, I could now see with my own eyes children and adults exhibiting the equivalent of strokes in the neurological exams I was able now to do, and I recognized that these neurological problems that I was seeing can only come from damage to the small end blood vessels going to the brain, and there's reasons for that. And with that knowledge, I also began to recognize that I was seeing these damages that were not there before an individual was vaccinated, and showing up shortly thereafter, and these individuals and children were having various problems with losing their language and becoming withdrawn and exhibiting stereotypical behaviors, and basically receiving a diagnosis of autism down the road, that it became A goes to B, B goes to C, and then a whole mechanism of injury emerged over that period of the last several years, which is where we are at right now. So, how is this happening in the body? Because you have to be able to establish proof causation for the federal circuit courts to appreciate that there is a problem, and if there is a problem in terms of the vaccines, we have polarized society. You have one groups that say there's no problem at all. Some experts say our children can handle 10,000 vaccines by the time they're 5 years of age, and because they're all killed or attenuated